Hi, everyone. Thanks for taking the time to join our Family Matters interview today. Today, we are joined by Dr. Jeff Gary. Welcome, Dr. Gary.
Thank you, Lynn.
We're so excited to have you joining us today. Our topic of discussion will be understanding more about the slippery slope of addiction, particularly for the older adult population. We'll be talking a little bit about risk factors and those issues of addiction that might be of importance to family caregivers who are taking care of an older adult who might be experiencing some of these issues. So let's start off. Dr. Gary, can you tell our audience a little bit about yourself and your background?
Sure. I'm a psychologist with Counterpoint Health Services. I've been a psychologist for over 40 years, and during that time, I've worked in mental health, substance abuse, and now currently I'm working with skilled nursing facilities and assisted living. What I've encountered over that time is often a combination of substance abuse and mental health issues. And we oftentimes have referred to that population as the dually diagnosed. So somebody with anxiety or depression may in fact also be using some particular kind of substance. In that context, we also know that people who have any kind of cognitive impairment, which frequently we're talking about Alzheimer's or dementia, the impact of the use of various substances, whether it's alcohol, illicit drugs, or even prescribed drugs, is going to have an effect on them.
That makes sense. Yeah, this is such an important topic for discussion. Um, can you describe for our audience, for maybe anyone who's unaware or hasn't experienced this, or maybe is experiencing it but doesn't realize, are there any warning signs of substance abuse that families can be on the lookout for? Any red flags or situations that they might want to bring forward to discuss with their primary care physician?
Absolutely. I've really divided the population we're talking about into three categories. The first category are those people that prior to becoming a senior had a substance abuse problem. Many of you, with your own experiences in your youth, may have used various substances, certainly alcohol, possibly marijuana. But what's happened over time, I guess thanks to modern medicine, is that people who probably might have died either from alcoholism or some kind of drug problem are now living a lot longer. It's not uncommon for me to encounter somebody in a skilled nursing facility who, at the age of 80, is still using marijuana or maybe even something like cocaine. So that's the first population. Oftentimes the family is aware that this person has these particular problems. We used to refer to people with alcohol problems who were working as functional alcoholics. But the emphasis should be on alcoholic. Even though they kept the job, brought home the paycheck, that doesn't mean that they weren't impacted in other ways in their lives. And oftentimes that's the population who is in really more likely serious medical problems like heart problems, liver problems, other organs in the body because of the length of time they've been taking those particular drugs. My second group are those people that have hit the golden years, the retirement. And many people talk about, oh, I just can't wait to retire. There's so many things I'm going to do. Or there's some people that just say, I'm going to do absolutely nothing. Can I tell you that latter population is the one that probably has the most difficulty with that time period because they structured so much of their life around their work. They also, in other cases, structured a lot around their family. So when they were younger and they were raising children, involved with activities either in their own lives or related to their children, suddenly those have been lost. They're not doing those kind of activities before. We sometimes refer to people like that as couch potatoes because they're just not doing anything. But what we notice is that they're hit by the biggest problem that a senior would have, boredom. These are individuals because they have no structure, they have no quote purpose for wanting to be involved in their lives, find themselves experiencing boredom, and sometimes people actually will turn to drug use as a way to counter that boredom. We also encounter people who are have lost friends, loved ones, and the older we get, and I've actually worked with people who are 100 years old, and they have lost not only their children and grandchildren, but even great grandchildren. And for most of us, we were raised with the idea that we go first, and then our children, then the grandchildren, etc. These are people that are under a very stressful situation because they're experiencing multiple losses, and losses either with individuals who've been in their life who are too young to have died, and but as well as their peers. And oftentimes, obviously, when you have spouses, there's a likelihood that you might have your husband or wife pass away. So most of the time, we find that the person doesn't have a lot involvement in other parts of their life, that they're going to be depressed. So we find that depression is also a factor with that particular population. What we know from experience is that many people will drink because they're depressed. The irony of that is alcohol is a depressant. And while everybody experiences the use of alcohol, the initial effect, uh, that wears off fairly quickly. And your body, in fact, is adjusting then to the fact that you now have a depressant in your system in addition to already feeling depressed. I sometimes refer to anxiety as a first cousin of depression. It's not unusual to see any kind of manifestation of behaviors take on more of an anxious perspective than the depressed. So again, you lose people who have been in your life, like family members. You start getting anxious. You get anxious about other people in your life. Some people even start getting anxious about their own life. And as a result of that, they're the ones that start feeling like, how do I get away from these feelings? How do I get away from the anxiety or the depression? Um, Oftentimes, these people were going to go a little bit less detected or undetected by other family members, simply because they know this person is anxious or depressed. And they may not be aware of the alcohol or drug use that these particular individuals are engaged in, particularly if that person lives alone. So, the only time family members, like their children or grandchildren, have encounters with them are on visits or holidays. And sometimes it gets explained away, well, it's a holiday. But if you don't see somebody on a regular basis, it's pretty hard to determine if they may have some kind of an alcohol or drug problem. The third group is those people who have identified there's a health problem and they're self-treating or self-medicating themselves. Should add, we oftentimes refer to the second group of people who use drugs that they are self-medicating themselves because their belief is this is going to help with the anxiety or the depression. Um, Self-medicating oneself, well, all of us do that. If you have an upset stomach, you take Pepto-Bismol. If you have a headache, you take ibuprofen or aspirin. So it's not unusual for us to try to come up with ways to take care of different maladies that we may be having. So that's a third population, and that's the one we'll probably be talking the most about because we're going to talk about their specific medical problems that they may be experiencing and let the role of different substances are going to play on that.
Yeah, that's really helpful to sort of think about the different ways this can present. I really like your point about if you're not seeing someone regularly, you may not detect subtle changes or
Mhm.
any kind of routine changes that are happening to that person's day-to-day life unless you're seeing them more regularly.
Absolutely.
You mentioned, go
I was
ahead.
going to say, on that note, let's talk about the various symptoms you may see. And again, even if you only see them in these little short periods of time, but you also oftentimes will get information from friends and neighbors of that individual. Not uncommon for a neighbor who has known that particular individual a long time to contact a adult child, or adult grandchild of that particular individual to let them know there are some things going on I think you
Mhm.
should be aware of. One of the biggest ones is we notice an interest of loss in activities that person used to regularly engage in. For example, my father, who did not have a substance abuse problem, but you could set a clock by what he did during retirement in terms of when he got up, where he went, who he visited with, some time at the pool hall that I accompanied him with, having lunch with some friends, getting back home and time with my mom, little things around the house, etc. When people stop doing those kinds of activities, there's something going on, so we need to be aware that that could be something. Already mentioned depression. And again, we shouldn't jump to the conclusion that the depression is simply an external event that has occurred. You may be seeing the effects of alcohol, that because they've been drinking, they might have used that drinking to kind of get themselves up and about, but eventually it's going to hit that impact. Anxiety, same thing. Take something to take the edge off the anxiety. Doesn't mean you stop feeling anxious, but you may not show as much of that anxiety as you would had you not taken something. Um, Spending more time alone. If your family member had been somebody who was very socially active, and all of a sudden you hear they've stopped going to certain clubs or organizations they used to be involved with, they turn down invitations to go out and go shopping with you. Then you start to wonder what's going on in their life that might be what's going on. Kind of a flip side of that is when you start seeing the individual exhibiting hostility. These are individuals who just don't want anyone to know what's going on. They also are people that they're just angry and frustrated with where they are in life. Again, oftentimes when I work with seniors and we talk about golden years, we all laugh because they're not golden unless you're in excellent health, you're independently wealthy, and
Right.
you have the love of a spouse and family members. So that's oftentimes probably something we have to encounter. You may also see that that person's more aggressive. So they may have been fairly laid back. Doesn't mean that they can't get angry, but you put it in perspective of, is that something they really ordinarily would get angry about and act on it in some particular way? Um, I know people that throw food at TV screens when their football team is not doing well. I make sure I miss the TV if I'm going to throw anything, but it's been a while since I've done that. We also will see forgetfulness. And that sometimes is sort of a precursor to maybe cognitive impairment or dementia. But there's also forgetfulness just because we will forget things if we've been under the influence of something. And we have to kind of either be reminded. And in some cases, people will dispute what you say to them about that. No, I never did that. You don't know what you're talking about. So we have to check that as well. Confusion, another thing that we'll oftentimes see with any of the things, substance abuse, mental health, or dementia. Um, Memory loss, I think, pretty much goes along with like the forgetfulness. What we notice in particular with people as they get older, and this is not unique to substance abuse or mental health, but it is unique to cognitive impairment, is the older we get, the more likely we're going to have worse short-term memory than we'll have long-term memory. You can have a conversation with somebody that can tell you something they did 50 years ago in vivid detail. Ask them what they had for breakfast yesterday, and they may scratch their heads or have to think for a little bit about what did I have. They may come up with it, but sometimes they go, I just don't remember. You'll also see people try to negate that kind of behavior. Oh, it's not that important to me. So they'll already be kind of setting the stage of, don't ask me to remember certain things. I'm just going to tell you it's not important to me. Okay. Um,
These sound like very familiar strategies that I think our families might recognize when kind of maybe talking to or deep diving into the routines of a loved one when they start to suspect maybe there's been some changes, the denial, the brushing it off, not acknowledging anything. Those are, I think, familiar to a lot of family members, just
right.
because with an older adult, sometimes they are certainly not willing to admit that they're having any changes in cognition or
Right.
memory. And
Absolutely.
yet on top of that, any type of, confrontation about a habit or a behavior, they may get defensive and immediately kind of change the topic.
Right.
So I
Now,
think those are really great warning signs for folks to kind of keep in mind.
now, I may be jumping ahead a little, but I think there are also some things that we would notice that it would be important for the person's doctor to be aware of, but we're the one that's going to notice it first. One is what we call secretive behavior. And that's when they're doing things that, where did you go? You would ask the person, oh, I was just out, or why are you taking the bottles of alcohol and you're putting them in a different part of the house where they used to be stored? And oh, looks like maybe you've got some more. But if they've been hidden well, you won't see that. This is also a time where the person may do some doctor shopping. And what they're specifically doing is trying to find a doctor that would prescribe to them or for them certain kinds of painkillers or other medications that they would like to have. They also hope that maybe if they have multiple doctors, they could get multiple prescriptions. And of course, pharmacies have done a pretty good job of trying to make sure that they're not getting the same prescription. Although some used to be people would go to different pharmacies. The problem even with that now is the insurance company. And the insurance company is not going to want to pay twice for that same medication. Doesn't mean the person isn't going to try. Um, we might also see some changes in their personal hygiene, um, their appearance. And then we are also start to hear them talk about health problems that seem to keep repeating themselves. So again, somebody gets older, the first thought they're coughing, and you're thinking, oh my God, what they have pneumonia? What kind of illness do they have? No, I just don't have that very often. And again, if you don't have a lot of contact with that person, you may not know that. These are people that oftentimes sleep a lot. If you're taking a depressant, you're going to sleep a lot. Um, I've also talked with people who say their anxiety is so high that they'll lay in bed staring at the ceiling, and the only escape they get from that anxiety is to try to fall asleep. Which, of course, if you can't do it on your own, well, you look for some kind of medication that might help you sleep better. So doctors may encounter somebody who says, I'm just not sleeping well. And I think with the seniors, we're much more likely to see doctors being more cautious, but that doesn't mean that they still won't prescribe something or that the person gets something over the counter.
And
Two
that's a
things,
really good point. Sometimes there may be a legitimate, medical condition going on where someone is seeking a consult, medication, let's say pain management, for example, but the family may suspect there may be an alternative, reason or ulterior motive for that. How how do we kind of figure those pieces out? Are there alternatives to, opioids for pain medication? Are there other safe things that can be prescribed for someone who might have this type of history that
ab-
that if I was going to say, if that a family could put on the radar of their doctor?
absolutely. I do want to add one more thing we see, and that's accidents and falling. The number one thing I always hear from seniors are their fear of falling.
Absolutely.
We're talking about broken hips, legs, wrists, arms, and everybody has accidents. But when you have a history that didn't seem to be in existence until you became older, had these kind of changes going on in your life. Also, with the accidents, family members say, oh, they've just had two fender benders. Well, one can happen, but now it's been a second one. And although nobody got hurt, it's still, there was an accident, kind of what's going on.
Yeah, now we've raised the risk factor, right? It's not just they're sleeping a lot. Now they might be actually putting themselves in danger of getting hurt or hurting someone else.
In terms of non-opioid medications, and of course, the opioids are, things like morphine and oxycodone, Oxycontin, um, Dilaudid. These are common medications that are prescribed for pain. Basically, the emphasis is on over-the-counter medications. It's on ibuprofen, it's on aspirin, It might be on acetaminophen. The one exception might, or a naproxen. The one exception is sometimes a doctor will prescribe the aspirin with codeine.
Okay.
So that still has something in it. Doctors are much less likely to prescribe that if they have any kind of information about the history of any particular kind of addiction that the person has. So those would be examples of non-opioid medications, which again, the person can get on their own, or family members can make sure they're getting them. Um, I'd be remiss if I didn't also include that sometimes pain management is something that can be at least be addressed with some non-medication approaches. And oftentimes we'll see pain management clinics where the focus is not on the medication, but on what are the kinds of activities a person can do to be able to deal with their pain. Oftentimes it's almost an avoidance. There are things that you can do
Like
so that you're not,
preventatives.
yeah, so that you're not focusing on the pain. Something about our focus and concentration, particularly with men, I guess, but we only can do one thing at a time. So, if you were focusing doing what they call guided imagery and being yourself in a nice, wonderful, pleasant place, if the pain wasn't too severe, you might be able to continue with that fantasy. Um, but we had always tell that the pain is severe when the person interrupts it and cries out in pain or is really identifying the pain. So that's another approach that people sometimes use.
Yeah, I know sometimes in talking with some older adults, they've expressed, maybe doing some stretching or yoga or meditation or some other non-medication
Mhm.
based intervention to help with pain management instead of immediately going straight to, can I have a prescription?
Right.
So for families, maybe looking at alternative or holistic approaches to pain could be another topic of conversation that
Sure.
they could have with their family physician if they suspect that pain management is an issue
Mhm.
or, they have concerns about someone seeking pain medication.
Mhm. So, let me say a little bit about specific areas of the body that are going to be affected um, by everyone, but we see the likelihood of it becoming more severe with people who have been addicting or who have been abusing various addictive medications. First, let's start with respiratory. And what we notice, first of all, is the older we get and the not as good shape as we used to be in. We might have experienced labored breathing, not getting enough oxygen. But that becomes even worse for somebody, for example, who's taking a depressant, because it's going to slow down your respiration. It's going to slow down that whole system. There have been people who have died as a result of not getting enough oxygen, passing out, not oftentimes dying because of that piece, but because they've fall down and hit their head or fall into something like a pool of water or something else, and they might suffocate as a result of that. So again, that could happen with any age, but we are knowing, particularly with seniors who may have a history of falling, that that's obviously going to happen more often. Cardiovascular would be another major area we'd want to look at. We have a slower heart rate as a result of ingesting very addictive substances. Blood pressure will also go down. So when a doctor's looking at prescribing medications for either the slower heart rate or the lower blood pressure, they really do need to know what else that person is taking. Not only their prescribed medications, but are they using any other possible addictive substances, which of course is going to have an impact on that. Cardiovascular also means heart failure. And what we know about heart failure is tied into blood pressure. If you're not pumping enough blood to your heart, then you're at greater risk of having a stroke or having a heart attack. Let me see. Was there another one I wanted to say?
Yeah, and these are a lot of these medical conditions that you're mentioning are common in older adults, right? So
They are, absolutely.
this sort of honest discussion and transparency with your doctor is really critical to make sure that you're getting treatment in the way that's most effective for you.
Absolutely. Our immune system is also greatly impacted. If you know people who have various illnesses with their immune system, that they're at greater risk for infection. So particularly when COVID was out, who were the populations that we were saying needed to be the most careful? Older people and people with autoimmune disorders. And if you're older and you have some kind of an autoimmune disorder, you were not doubling the risk, but you were at a greater risk
Hmm.
of contracting the COVID, and also how you survived it. What we saw was many people got COVID. They all didn't die. But what we oftentimes saw is people who had other illnesses or just being older, is that they were put at greater risk for that. I know this from personal experience. I have some older siblings. Um, One of them died of COVID. He was 90 years old, but he'd been in reasonably good health prior to that, but mostly because of his age. It
Hmm.
seemed to be that that was what had the impact on him. I got some others. Let me see. Let me check my notes here. Um, okay. Um, I think some other things that they just might see are oftentimes the effect of their drugs, like dizziness. The person may talk about, oh, my balance, and that again ties into things like balance. Um, Also ties into um, overall metabolism. The older we get, and of course, anybody who is gaining weight and wants to blame it on something, they're going to blame it on their slow metabolism, which oftentimes they find out that's not what it is. But our metabolism does slow down. And it does mean that we don't process the calories we're taking in as well, can lead to other kinds of maybe gastrointestinal problems that the person didn't have when they were younger.
Yeah, this is really good information. I think our families are really going to appreciate just a good overview of sort of what to be on the lookout for, what medical conditions might already exist that could be um, exaggerated or worsened by using substances. And really kind of having that open dialogue with their physician is so critical. I know we're almost out of time. Are there any sort of go-to resources or recommendations you have for families? Are there any places they can go to just start their journey on learning more about substance abuse for their loved one?
There are, and I'm going to dovetail into something they specifically can do with that family member. Um, Wherever the person lives, there's always either in the county or in the state, there are usually departments of mental health and substance abuse. Those two fields really kind of combined, and they're aware of various treatment programs, educational sources that people, a treatment program, you may not be getting that person to go for treatment, but you can get the various materials of an educational nature to do that. Um, there are groups, if they want to go to a group called Al-Anon, that's a group for family members. It's like a self-help group. There's no therapy or counseling going on. It's just support from other people who have a family member. If it's other drugs, they tend to go to something called Nar-Anon, which was based on Narcotics Anonymous. And going to that, they can get the same kind of support. One of the big questions is, so what do I say to this person? What do I say to my parent, grandfather, whatever? There's a thing called an intervention. They've been around a long time. And oftentimes, if you call one of these treatment programs, they will say, are you interested in doing an intervention? What an intervention consists of is gathering as many people, friends, family members, who are aware of what's happening with this particular person. And what we find is there's strength in numbers. If one person has a conversation with you, easy enough to kind of go, no big deal. It's just this person. If you've
Mm-hmm.
got a room full of people who know you, who love you, then you've got a better shot at maybe listening to something that what they say. Um, Couple criteria. One is you'd never do it when the person's been using any drugs because you're not talking to that person. You're talking to them under the influence of a drug. The second thing you want to do is be factual. You just want to say what you observed. You don't judge it. You just simply say on this occasion, and you want to make them as relevant to you and the impact it had on you, what that other person did. So, for example, a parent might say, I brought your grandson over and I was just embarrassed for him. Embarrassed to the extent of, I always check with you before I come to make sure you've not been drinking because I am not going to expose him to you. I don't want him to see you in that vein. And then just the overall support. I know how tough it is, whether it's your age, mom having passed away, all these kind of things. Anything that might help you with that, we would encourage you to do. So those would be the kind of the goals you would expect for family members to say to that person. As soon as they get hostile, it's over. You don't even bother to continue with the conversation, but you do set the parameters. If there hadn't been, I'm not bringing your grandkids over if you've been drinking. I'll come to the front door. If I smell alcohol in your breath, we're turning around. Or, whatever other kinds of interactions had been going on with that particular individual.
Yeah, it sounds like getting some professional support in there to help set boundaries and make referrals and coach you through those tough conversations could really be advantageous for families.
Absolutely. In fact, most of the time, a treatment program will say, we're going to have one of our staff with you. It's not
Even
just going to
better.
be you by yourself. And they will have done some discussion with the family members about what are you going to say. So they're going to make sure, oh, don't use that. That's judgmental. Or, that's accusatory or
Hmm.
anything that might not stick to the facts, stick to what's going on. And the same thing with what are going to be the consequences if they don't make changes. Oftentimes say, well, I'm never going to let you see so-and-so again. And a month later, they let them see so-and-so again.
Right. Don't say things you can't stick to, kind of thing.
Absolutely.
Yeah.
Absolutely.
These are really good tips. I think having all this information available for our families is going to be really helpful. It's going to
Yeah.
put them on the right path. I so appreciate you sharing your time and expertise with our families today. I know this topic was an important one and common, unfortunately, out there in the population. So I know this information will be really used widely by our family audience. So thank
You're,
you so much.
you're welcome. Terrific. Glad I could do it.
Thank you.
You're
Thanks
welcome.
everyone for joining our call. We'll see you on the next interview of Family Matters. Thank you.